We have a quorum. Could you please invite the administration and the deputations to join us? Welcome the administration and deputations. Today, the meeting is on aging problem of persons with intellectual disabilities. I remember a few years ago in Ngau Tau Kau there was a tragedy. A person with intellectual disabilities, PWIDs, who's in her 40s, lived with her 70-year-old mother. Every morning they had to scavenge. And this morning, the daughter did not want to go out. And the mother went out, a fire started at home, and the daughter was killed in the fire. And we find that very regrettable. And it shows that in our community, there is the aging problem of PWIDs, and that their carers are going on 70s or 80s. We would like to find out how we can improve supporting services, because for PWIDs, the aging problem does not start when they are in 60s or 70s. There are signs of aging when they are in their 40s. So if we see that a person is an elderly person when he or she reaches 65, we see that for PWIDs, such signs appear before they are 65, but they cannot get all the benefits and supporting services available to people over 65. So we need to explore how we can offer assistance on a policy level. We have 8 deputations coming to speak with us. Well, perhaps I will first quickly ask the administration to quickly take us through the paper. Mr. Siu? Well, first of all, I'd like to speak on support on welfare service and what policies or measures we have. And when it comes to a hospital service, I will defer to Ms. Zhang. First of all, I'd like to thank the chairman for calling for this meeting, and I also thank deputations and carers, parents themselves, to come to speak to us despite the cold weather. When it comes to rehabilitation service, we target the different needs for rehabilitation services for different groups of people with different disabilities, because due to their differences, there may be different needs. So we target the different needs of the individual. First, residential care services. There are different types of residential services available to people with different care level and handicap level. We have residential care services, we have hostels, we have care and attention home. And when it comes to vocational rehabilitation services, we have sheltered workshop, we have integrated vocational training day. When it comes to community support, we have strengthened our services. We have 16 district support centers for persons with disabilities. And we have heard from the community that on different areas there is room for improvement and strengthening. And we will strengthen our services. And when it comes to home care service for persons with a severe disability, there was a pilot scheme back in March 2011. It provides home-based personal care services for people with severe disabilities, including persons with severe intellectual disabilities. In March next year, this service will be regularized and extended to all districts in Hong Kong, irrespective of whether they are on the waiting list for residential care services. These services include home-based care services. And we will strengthen our service by adopting a case management approach. We will listen to your views so that we can increase the strength of our services to target needs. When it comes to medical services, PWDs, including PWIDs, they have their lifespan is longer and longer. So there is a need for change as a result of the change in demand and supply. And since 2005, we have put in place a number of measures to meet the needs of aging service users with deteriorating functioning capacities. These include an extended care program, work extension program, and in sheltered homes and day activity centers, there will be tailor-made activities for those suffering from deteriorating health conditions. And we also provide occupational therapy or physiotherapy services or care nursing services. We have the visiting medical practitioner scheme, and there is additional funding to strengthen our service. And when it comes to an increasing number of aging service users, starting from 2010, every year there is an additional recurrent allocation of about 39 million to strengthen physiotherapy service and health care services in residential care homes. In November this year, the SWD allocated an annual additional recurrent funding of about $70 million to NGOs to strengthen the manpower of residential care homes for people with disabilities, including different types of hostels. And the funding for visiting medical practitioner and other services, say for example work extension program, is also increased. If necessary, these residential care homes can apply to lotteries fund for procurement of furniture and equipment items to meet their needs. Starting from 2010, the Queen Elizabeth Foundation for the Mentally Handicapped has launched the scheme to support aged persons with intellectual disability to provide subsidies to create a more suitable living environment for PWIDs. In the past few years, there has been a total of $3.24 million funded for 68 projects, including different types of rehabilitative facilities and training classes, etc. We do realize the need to put in place targeted measures for an aging number of users. So we review the measures implemented to see how we can improve the existing measures. So there is a target group formed on aging of users of rehabilitation services. They have completed the review and released the report in September. And they have made recommendations, say for example, in short-term measures, injecting additional resources to enhance manpower to the various centers and programs. And when it comes to services with a wider scope and long-term measures, a working group has been set up to make recommendations in the short, medium, and long-term measures. They will conduct an in-depth review and study.
Well, for the working group, other than looking at long and medium term improvement measures, if they have short-term measure proposal, we also hope to implement them. We hope that we can put together some practical and feasible options, and they will be implemented as soon as possible. The working group is working very hard at the moment, and its members comprise parents, government officials, and other stakeholders. Of course, that would include the Department of Health, Hospital Authority, SWD, etc. So that's my briefing, and I would listen to the deputation's views, and later on I will give you a more detailed answer, and I will reply to the deputation's questions. And now I would like to invite Ms. Zhang to talk about healthcare services. Now for the Food and Welfare Bureau, we have services to support the PWDs and PIDs. And later on, I will be asking Dr. Chung and Mr. Fong to supplement. As for healthcare service, now the HA has an interdisciplinary team, and we provide different types of services for the PWDs and PIDs, for example, outpatient and inpatient services, etc. Now, many PIDs live in the community. So for them, we want to provide better support. The psychiatry department of the HA would send outreach teams to the community and to institutions so as to provide follow-up services to them. Along with heard voices saying that when PIDs go to see doctors, they may need special assistance. And parents also do not want their children with ID to interfere with other people. So we have provided a special arrangement for PIDs if they go to specialist clinics for consultations. If the circumstances of the clinics allow, special sessions will be arranged for such PIDs. And the HA has also put in a lot of resources in the past few years. We are providing the second-generation antipsychotic drugs to patients. Now, if it's clinically viable, we would try our best to provide the second-generation antipsychotic drugs. As for dental services, all along, a lot of people have told us that for PIDs, when they seek dental service, they would encounter a lot of problems. So under the Department of Health, there are 11 government dental clinics, and at public hospitals, there are also emergency dental services. This year, the DH has made a special arrangement for students with ID under the age of 18 who are studying in special schools. They may now participate in the school dental care service provided by the DH. And every year, they can receive one oral health checkup, which is provided by the DH. And in August this year, together with the Hong Kong Dental Association, we have provided subsidy to the Hong Kong Dental Association, the Hong Kong Special Care Dentistry Association, and the Evangel Hospital for implementing a 4-year pilot project on dental services for PIDs. For PIDs that are on CSSA, and if they are over 18 years old, they may receive dental checkup, dental treatments, and oral health education in dental clinics participating in this project. Some PIDs have told us that they may need sedation or anesthesia when they receive dental services, and they may have encountered problems in the past. So in August this year, we launched this pilot project in the hope of helping the PIDs. And maybe I will invite Dr. Chung to supplement. Well, we have limited time, so let us ask the deputations to speak first, and then we will hear your replies. Although we have 2 hours, we have 7 or 8 deputations here. Now, you will each be given 5 minutes. I understand that some of you will be playing videos. 3 minutes each person. And that 3 minutes would cover the video. And for what you say, they would not be protected by the Legislative Council Powers and Privileges Ordinance. You have to be responsible for your speech. First of all, Mr. YIP Kei-chun from Grace Parents Association. We hope that the government can set up a PID commission so that studies, assessments, and implementations of policies can be carried out by one bureau, by one commission. Now, there are a number of commissions under the government, but there is not one for PIDs. for this kind of services, they should also cover the parents and carers of PIDs, and the number may exceed 1 million. Well, many families may not have the means to take care of their PIDs, so we need service to be provided to us. And the government is discriminating against us at the moment. In particular, Mr. Matthew Cheung, on the 3rd of December 2012, I talked to him, and I said that it's a very urgent problem. It's a matter of life or death. But after 1 year, I have received nothing or no reply from him. It proves that he is discriminating against PIDs. The government is discriminating against PIDs. That's why we do not have enough support. Our problems cannot be handled immediately, and the treatments for some PIDs have been delayed. For PIDs over the age of 45, they may even suffer from stroke, and many of them die early. And if those who do not die, they may lead a very miserable life. Well, for a care home, I have seen at least 10 PIDs being intubated for a very long time, and they have to be bedridden all the time. They have to buy expensive, nutritious food for themselves. The caregivers would have to give them a lot of care. For example, turning them in bed, and also diapers would have to be bought for them. But all these are not subsidized by the government. The government should carry out a survey trying to find out how many of these people are suffering. They are really leading a very painful life. Well, in Taiwan, for PIDs over the age of 40, they can enjoy an annual physical checkup, and there are preventive measures so that they can enjoy a healthier life. Now, the government should bear all the responsibility. And although now there is psychiatric service for PIDs, those with severe or profound IDs are not covered. And we suddenly were notified that persons with severe and profound IDs will not be served. The Grace Parents Association has been asking the HA questions, and at that time Ms. Cheng Sok Mui said that is a new assessment mechanism. I object to it because it is divorced from reality. At that time, the government had financial problems, so it asked all the government departments to save, and the HA came up with this bad idea. Doctors should not do so much outreaching work, and PIDs should go to hospitals to seek consultation. The SWD states that for PIDs, the two PIDs, if they have to go out, they have to be accompanied by a social worker. But this is not subsidized by the government. So this is what I mean by departure from reality. And the government is now still adhering to the assessment mechanism implemented 10 years ago. Actually, we should reinstate the practice before 2003. And now the economic situation has changed. For a person with medium ID, if it's hard to take care of a person with medium ID, it's very difficult. And of course, an elder cannot take care of PIDs. Yes, Mr. Yip, we understand that. Your time is up. If there is time left, I will give you another opportunity to speak. Let us listen to other deputations first. Mr. Yip is a parent of a PID. He has been with the Grace Parents Association for many years. Next, we would invite Ms. Wendy Leung, the Secretary of the Grace Parents Association, to speak. Let us air the video first.
我仔叫梁42歲，住喺院舍，嚴重嘅弱智。因為咧，佢就身體有時唔識話，希望政府咧就每年俾醫生去檢查。希望咧政府咧唔好收咁多人啊！而家咧院舍好擠逼，驚咧啲細佬哥咧會跌倒，希望咧政府咧增加多啲人手，就醫護嘅人手。啲仔都老咗，賴屎賴尿多咗啦，沖涼都沖多幾次啦，行行得差咗，食嘢食得差咗，希望咧多啲人手照顧下佢。24小時咧照顧咧唔容易嘅，希望咧多啲人手照顧。政府高官咧要下決心，要做嘢啦。
係。The old lady is mobility suffering from mobility impairment, so she cannot come, but she would like to have a panel set up to oversee the welfare of PWIDs. And currently, the administration has adopted a patchwork or piecemeal approach only to tackle the symptoms. The district support center and community services for those with severe disabilities is set to be extended to all 18 districts. But so far, no additional premises have been identified. We hope that the daycare centers the number will be increased to provide services for those living in the community and to increase a carers subsidy and to reinstate the outreach service. Thank you. Next is Hong Kong Society for the Blind Morning Glory DAC Hostel, Ms. Lee. Thank you. I think you have read our written submissions, and so we're not going to repeat. And I'd like to respond to how the HA, the Hospital Authority, can cooperate with us to enhance our services. Well, when it comes to the outreach psychiatric service for Siu Lam Hospital, there was no additional resources given after 2003. And not all doctors will visit the residential care homes with severe disabilities. Well, since doctors will only attend to those suffering from severe disabilities in residential care homes, so we have to take inmates with mild and moderate disabilities to seek medical services ourselves. So there should not be a delineation of service. When doctors come to visit us, they should attend to all patients. For mild and for residential care homes, for mild and moderate handicapped people, there is insufficient services. We don't have sufficient amount of healthcare workers to provide a service. For supported hostel and for the workshops, we don't have healthcare workers, we don't have nurses. So when PWIDs staying in hostels or working in workshop, they apart from their mental disability, they may be suffering from mental illness, say for example schizophrenia, and on top of that they're aging, so they may be suffering from dementia as well. So we can't tell what is bothering them, what illness is affecting them at a definite moment. So for supported hostel and hostel for moderately mentally handicapped persons, yes, there are additional resources and funding, but that is still not enough, because the additional funding goes to the recruitment of healthcare workers at the front line, not nurses. It helps, but the amount of money given to us will go straight to the healthcare workers. I really would like to engage some healthcare workers in supported hostels and not just helpers. So we would like to have some comprehensive support for supported hostels and hostels for moderately handicapped persons. Next is Hong Kong Down Syndrome Association, Ms. Chen. Well, we're a group representing people suffering from Down syndrome. There is an aging problem. They can't wait till they're 65, because when they're 65, the parents will be in their 90s. How are we supposed to take care of them? You can see that from television programs that a 70-year-old cannot take care of a daughter in her 40s suffering from Down syndrome. So we need residential care service for both carer and the children as well, because you can't ask the parent to go to a residential care home, or the child, him or herself, to do so by themselves. We know that it's difficult for able-bodied elderly person to get a place in residential service, let alone those suffering from Down syndrome. There is a large number of people suffering from Down syndrome who are in their 40s who cannot get a place in residential care homes. So we would like to get some kind of service, say a home-based care service in the community to help us. Because this will alleviate the pressure on us to send them into homes, because parents themselves are in their 70s. And these are families that would encounter serious problems. So we need RCHD places for people with Down syndrome, or a home-based care service. And what about clinics for people suffering from Down syndrome? I am a victim because my daughter cannot find a suitable doctor. So she's been seeking medical services, medical attention from the public sector. We get better service in the private sector, but it costs us easily $3,000 each time. We don't have that many $3,000 to spend. So we need a dedicated clinic for people with Down syndrome. It's an urgent need, because there will be an early aging for people with Down syndrome. That's a reality. We can't wait till they are in their 60s before we can make an application. So please reset the age limit. Don't make them wait till they're 60. Next is the Hong Kong Joint Council of Parents of Mentally Handicapped. Mrs. Jiu. We're a non-profit making organization. We provide services for people suffering from mental disability and their parents. We have over 100 parents that are over 70 years old. Aging is a serious problem. In sheltered workshop, there is no retirement age. If you work in a sheltered workshop, even if your physical condition deteriorates, or when you reach retirement age, you can either stay or withdraw from the workshop. But parents find it difficult, and there is nothing else for these people to do, so they would rather stay. We have the WCP, the extended service, but such service is not available in every home, but there's a work extension program. But the demand is increasing every year, and the quota is set. Please do something about it. For the day center, the vocational training center, well, there are more and more newcomers who are suffering from autism, but there are some existing users that are suffering from ADHD. There will be a clash. So can there be some kind of family care center for them? And the outreach service. The outreach service is not something new, but there are centers not receiving the service. So the visiting doctor scheme is of little help. Well, I hope that we will be able to get more and better services. If we have a daycare center, it will alleviate the pressure on the vocational training center and the sheltered workshop. We have an aging problem with people with intellectual disabilities. We know that there are lots of RCHDs asking for their facilities to be upgraded. We see that, well, the temporary service at the temporary facility is seriously lacking. And you can't expect someone in their 70s or 80s to take care of their children at home. We hope that there will be residential centers, residential care homes for both parents and children. It's not that we don't want to take care of our children, but when we reach a certain age, we will not be able to do so. But we would still like to see our children. And when we visit them, it will calm them down. So it's a win-win situation. Next is a concern group for the aging problem of PWID. Mr. Wu. Doctors recognize the fact that for PWDs or PWIDs that they will have an early aging problem, and that's also mentioned by the chairman, and their life expectancy has increased. So we have to take care of our children for another 1 or 2 decades. About 10 years ago, they have a life expectancy about 30 or 40, and now they live longer. So we hope, as a result of a better medical service and medicinal advancement, we have, and on a number of occasions, strongly asked the administration to tackle this problem. Just like an ordinary elderly person, people with disabilities will need their demands met. For people who cannot stay in daycare centers anymore because of a deteriorating functioning capacity, that they are asked to stay at home. Well, that was in 2004 when the finances of the administration is poor. But the extended service is only a makeshift measure. It should not be regularized. And we read from the report of aging of users. We see that there is a little bit more funding given to sustain the service, but this service is of a short-term nature. It should be improved and turned into a long-term measure. And we hear a lot of improvement, enhancement of the different programs and measures. But there is only limited funding. When the money runs out, well, how are these programs and services going to be sustained? For PWIDs, their physical condition deteriorates. Well, there is a program for grassroots. It's a medical scheme, but you're only eligible when you reach 65. And I have a friend who's in their 60s. So when the child reaches 65, the parent will be 100 years old. What about the elderly healthcare voucher scheme? Can it be made available to PWIDs? Well, next to me, one is suffering from Down syndrome and the other one is a parent. Well, they're very nervous, and I'll try to talk to them to get them to speak. Next to me is Mrs. Chiu, and this is her son, Kin Leung. He's now working in a sheltered workshop. Mrs. Chiu, about 10 years ago, we asked you to apply for residential care home. And Mrs. Chiu at that time declined it.
Well, I would miss my son if he's put in a hostel. All my other children were married. So my husband and I now, well, I don't really want to speak. Well, the three of us live together. If I send him off to a hostel, I would really miss him. And my husband has passed away now. I am now 78. Now he's been living in a hostel for 1 year. And I eventually made this decision because I knew that I would die earlier. Would his elder brother or his sister-in-law take care of him? No, I don't think so. So that's why I put him in a hostel. Fortunately, well, actually, he's been making the application for 3 years, and now he's in a hostel. So what's his health condition like? Well, he has spasm, and his walking ability has been deteriorating. You just saw him fall, and he falls all the time, and he cannot squat. The joints of his toes are protruded. Look at his hands. His joints are swollen. And he also has dental problems. He cannot squat. Now he's in his 40s only. I am now 78. I will definitely die earlier than him. So what will happen to him? So how about his teeth condition? It's very bad. He has no teeth left. Well, when he was growing up, he lost his teeth one by one. Well, ever since he was a kid, I wonder if it has anything to do with calcium. But the doctor said that it's no use taking more calcium. If you take more calcium, the bone will become fragile. Now he has denture. Of course, it's very inconvenient for him to eat. Ken Leung, do you clean cars now? You are very good at that. How many cars are you cleaning? 3. He doesn't know. He's now working in a sheltered workshop, and the manager of the sheltered workshop would ask him and another person to clean 1 car per week because, well, he cannot do it by himself. He cannot squat. So, Mrs. Chiu, you said that you are afraid that you would pass away earlier and nobody would care of him, to take care of him. So what do you think of the present situation? Well, after I die, well, I can rest assured that he will be taken care of in a hostel. Definitely, I will die earlier. Mrs. Chiu, how about Ken Leung's daily expenses? Because you have to take taxi all the time. Well, he has to go to see doctors. I can make a calculation for you. Now he's on CSSA. Well, ever since he was put in a hostel, I applied CSSA for him, and more than $1,000 will be paid to the hostel. Later on, if we have more time, I will ask Mrs. Chiu to share her feelings again. Thank you. I would like to thank Mr. Wu, Mrs. Chiu, and Mr. Chiu Ken Leung. Mrs. Chiu, what is happening to you is also happening to me. I'm also in my 50s. My daughter is 20-something. If it goes on like this, well, sooner or later I will die, just as you will. My child will also be aging. So I think this is really sad. I have written an article on this, saying that it is a blessing for the old to see their young die first. Well, because for families like us, we'd rather that our children pass away earlier because we don't have to be so worried about them after we die. This is really a tragedy. Our parents should not be left like this. I share your feeling. I really do not want to put my child in a hostel. Well, I missed something. I really want him to die before me. Then I can rest assured when I die. I always tell my friends this. I hope that he can die before me. But is that possible? I don't think that's possible because I'm already 78 years old. Yes, I understand, Mrs. Chiu. Well, I think only people with personal experience would have this kind of feeling. Well, our government officials are very professional. I hope they can understand this. Just now, the deputations have touched on a number of areas, including psychiatric outreach service. You said that has been provided all the time, but Mr. Yip said that in 2003 it was cut. And Mr. Chiu also mentioned, Ms. Lee mentioned that for the psychiatric outreach service, if you go to an institution, you would not see all the patients because for persons with milder ID, you would not see them. You just take care of those with more severe IDs. So I think that the service extended are not really the services in greatest need. Some people need specific services, but you do not provide the services to them. And the institutions are very crowded. You are saving on cost per unit. Well, they need a daycare center, but now you just have an extended care program and they would have to remain in day activity centers, and these centers do not even have money to hire more healthcare assistants. So for the aged PIDs, they need more care and intensive care, but your subsidy is not enhanced in those areas. This is absurd. But of course, I understand that a daycare center is even more expensive. Well, for all these issues, you really have to face them squarely. Mrs. Chiu mentioned her condition. How can you reassure her? Her child is now in a hostel and his health is deteriorating. So is it still suitable for him to work in a sheltered workshop? And for the Rehabilitation Advisory Committee, what kind of things will be discussed? Do you have a timetable? Do you have a plan? Mr. Siu or Ms. Chang? Chairman, I would like to thank the deputations for their views. They are very concrete views. And the RAC has set up this working group. The working group is exactly looking into these issues, and we have many directions in common. Just now, some deputations said that they hope that a commission on PID can be set up. Well, the RAC is a major advisory committee of the government working in this area, and it has set up a working group on aging of persons with intellectual disabilities. Well, other than RAC members sitting on this group, there are also representatives of parents and healthcare sectors, etc., sitting on this working group. Of course, we have to look at long, medium, and short-term improvement measures. For medium and short-term measures, if we have the same goals, then things can be moved ahead. And now we are fighting for resources. We hope that, well, definitely there won't just be talk. There will definitely be concrete actions. In half a year, the working group has held 2 meetings already, and the next meeting will be held on the 30th of December. And they have also set up a task force on rehabilitation services because they have discovered a lot of operational problems. We hope that the task force will also put together some specific recommendations, and so that some pilot schemes can be put in place. One of the things that we're discussing now is that, while we all agree that the extended care program should be a transitional one, it is an expediency, as said by Mr. Choi. That's right. We should target the needs of the PIDs. Now, for a sheltered workshop, it can also provide rehabilitation services, and also providing services for the aging PIDs. That's another service. If people are kept at sheltered workshops, of course, it may not be the most appropriate approach. Well, one of the suggestions is setting up a daycare center. And would the daycare center be providing services targeting different service users? Some parents also hope that the children can be kept at home or in their original districts. So for the aged PIDs, when should we be referring them to other service units? Well, we are discussing all this. Several NGOs are implementing some pilot schemes. I understand that the Down syndrome group is doing that, and also there is another pilot scheme in which the elderly and the PIDs are put together in a residential care home. If there is a need, we can apply to the lotteries fund so that more programs can be implemented. we have to look at the views of users, etc. So this working group is discussing some very concrete issues. And we already have a consensus. That is, we hope that we can conduct a more detailed survey. Well, a checklist has been put together by the task force, and we are now looking at the service users, trying to find out how many of them would need services that are tailor-made for the needs of aging service users. We hope that in the first half of next year, a comprehensive survey can be conducted. We can look at all the service users, well, at least 10,000 of them, then we would have a more comprehensive picture. Now, this is very important. Only by doing so can we know how many people will need what kind of service. So these are the specific issues that we are discussing. We are not just looking at directions. Of course, we will have to look at directions. For example, the need for RCHDs. Well, there is indeed a need for increase in places. And streaming is also important. And thirdly, we would also target community service. We have home care service now. We hope that we can be more target-oriented. We will provide more services to the aging PIDs, for example, respite service or visits or home food delivery service, medical consultation, accompaniment service, etc. So all these are being considered. So for the increase in RCHD places, of course, we will look at that, and there will be more need in the future. Manpower and facilities would have to be enhanced. Yes, we understand all these, and we need that. There is a huge need for RCHDs. But we may not have enough places in a very short time, so that's why we will provide more community support.
We don't just look at long-term measures. For medium-term measures, we have consensus that we will get more resources and explore and work on the specific mode of delivery of our enhanced services. Ms. Zhang, thank you. When I thank deputations for coming to speak to us, what they say is of high reference value. As I said at the outset about these designated time slot of specialist outpatient clinics and also the pilot scheme for PWIDs for dental services, we will explore other areas where we can provide targeted services to meet the needs of PWIDs. Now, a number of deputations have spoken on the psychiatric outreach service. I understand the HA has done a lot in this regard, but because of manpower limitations, the scale of the service may not cover as widely and deeply as wanted by the deputations. I will defer to Dr. Zhang to expound on their outreach service. I thank everyone for expressing their concern about this service. I apologize on a number of occasions, and I will also apologize now. In 2003, when we restructured the service, for the outreach service, we focus on those with severe disabilities. Communication was not done properly, and it has caused some ill feelings, and I apologize. Currently, there is a team of healthcare workers in Siu Lam and Kei-chun Hospital for providing the outreach service, covering over 40 RCHDs, mainly on people suffering from severe disabilities. And of course, there is a limited degree of services available for those with mild and moderate disability. We are met with limitations, mainly manpower problems. And as you know, that we're talking about patients seeing doctors. As a whole, there is a shortage of doctors. There is a huge demand for doctors in the psychiatric service. In the past 5 years, yes, there is an increase of number of doctors, but at the same time, demand of all areas, geriatrics, pediatric, young persons, have all increased. We agree with that direction, that our service should have a wider coverage, but there are problems, especially manpower shortage. When it comes to services for PWIDs, those with severe and moderate disability accounts for 80% of our demand. So if we extend the service from severe disability to moderate and mild, we're talking about a huge demand. I understand that parents themselves are aging as well, but currently we rely on them to take their children to psychiatric clinics to receive attention. Dr. Chan, for persons with moderate and mild disability, they account for 80%, and there is a smaller number of people with severe disabilities who are receiving our service. Of course, for PWID, that is just some of our service, because if they suffer from eye problems, they will go to see an eye doctor. And not every PWID has to seek a psychiatric service. Overseas countries, in overseas countries, there are about 30% of PWIDs who need a psychiatric service. When it comes to outpatient service, of course, we want to enhance our service. In the NT West cluster, Kowloon West cluster, and Island West cluster, there are psychiatric clinics providing dedicated service for PWID. We understand that if they share the service with able-bodied patients, and there may be some problems. We hope that in the coming 4 years, in the other clusters, we are confident that the dedicated service will be set up in other clusters. I'll now open the floor for members. Leung Kwok Hong, Poon Siu Ping, and Chung Kwok Pan. This morning, on the radio, I heard that Anthony Leung would like to run for the chief executive. Starting in 2000, he said that we should spend where is needed and save when it's needed. And all the cost cutting and cutting manpower started from them. There is nothing small in people's livelihood. CY Leung went to a community center in Tai Kok Choi. You know where it is, right? Do you know whether there are lifts or escalators in that community center? There is none. Well, it's the first time that I was carried into the venue to protest because I don't want to use staircases. Well, the chief executive went out, we visit districts, and he said that there is nothing small in people's livelihood, and he even wrote a book that say with the title of If They Were Your Children. And now you say that, yes, we know that we've heard you, but do you have the money? Would it be reflected in the policy address? If it's not mentioned in the policy address, well, how will we get money? Of course, it's the duty of Mr. Matthew Cheung. Mr. Siu, I pity you, because there is nothing much that you can do. Well, civil servants always say that, yes, we know. But when it comes to pilot schemes, they are only expedient measures. You always say that we don't have enough resources. Just put them here. And we'll find ways to improve. But that is a wrong idea, because you only think about input and output. Well, if the input is $1, it can churn out $1.50, then you think, oh, it's a good measure. Well, you have to put yourself in their shoes, whether they're receiving appropriate measures. If not, how many years it will take before they will receive such service. Well, officials' mindset is that if you put in $1 and it will generate $1.30, then it will be great. That is not right. Well, but if you should think that, well, if you put in $1, then half of the problem will be halved, then that will be great. Well, if you need $6 and you say, well, I can only generate $1.50 with $1, and about the shortfall, well, there's nothing I can do. Let's look at housing society. You give them a piece of land. They have this luxurious housing scheme where you can live with your elderly parent. It's a piece of precious land, and it's not a good measure. It's not a good solution. So you only look at input and output, that the government put in a small sum of money to have something that are seemingly effective, or do you really want to solve the problem? It's the government's duty to solve problems. And if you don't have that mindset, there is nothing that one can do. And you now want Anthony Leung to come back. Well, CY Leung has said a lot. And he went to a community center with no lifts or escalators. Practically, he has excluded people with disabilities and the elderly. On that day, Matthew Cheung was there. What kind of people are they? I'm not going to scold you. It's nothing to do with you. I don't trust this government at all. It should disband. You should keep in mind the problems and flaws in society and to think about the problem people are suffering and try to help them. Instead, you say, we have no money. This is all we have. This is all we have in our pockets. Mr. Siu, have you told Matthew Cheung that every day I go to Legco, I am scolded? Do you have money? Give it to me. Well, tell me. If you have told Matthew Zhang, and then it's Matthew Zhang's problem, and if Matthew Zhang hasn't told C.Y. Leung, it's Matthew Zhang's problem. If he has, then it's C.Y. Leung's problem. And if after he's told and still he chose that particular community center, I think he should simply drop that. Mr. Siu, anything to say in reply? As I've said, we have been trying to get more resources devoted into the aging problem of PWID. We have an increase of $120 million in the current expenditure. We need the resources to be channeled to different areas, say for example healthcare and nursing. Chairman, that's exactly what I said. You only talk about how much you have increased, but the problem is still there and it's getting worse. We're talking about an aging problem, and you say that, well, we have an additional expenditure of 120 million, and you should be thankful. But we're not talking about the efficiency of how much you've spent, but we're talking about whether you can resolve their problems. Have you done any assessment? You have been doing assessment all along. Have you assessed the impact on PWIDs and their carers in face of the aging problem? If you have done that, then there will not be that ridiculous scheme where you have to spend a lot of money to buy a flat and to rent a flat to accommodate your elderly parent. Well, I think Mr. Leung asked whether we have for additional resources and whether we have provided targeted measures. That's why in the various working groups and target groups we are working very hard to come up with targeted measures. We will get additional resources to implement additional measures. In the past few years, we have an additional expenditure of 120 million, and we will continue to do so. What about those who are stuck at sheltered workshop? Can you move them to residential care homes? Have you increased resources to sheltered workshop? Yes. Is that enough? Mr. Leung, maybe you will wait till your next round. Then you don't need to talk about specific measures. Just talk about money. What about 100 million? Is that enough? Can John Zhang see it? If that is not enough, give another 100 million.
Mr. Pun, I would like to thank the deputations for coming here to express their views. Well, they have made one request. They hope that a commission on PIDs can be set up. And the commissioner said just now that the RAC in May this year has already set up a working group on aging of persons with intellectual disabilities. For that working group, would it be able to cater for the needs of the deputations? You say that the group will be looking at long, medium, and short-term improvement measures. Now, what is meant by short, medium, and long-term? You said that each year resources are earmarked, and just now you mentioned the amount of $120 million. Now, for the frontline workers, I think there is a huge shortage now. So for these recommendations, would they cover the training of frontline workers? And also, the doctor told us just now that in 2014, a designated clinic for PIDs will be set up. Can you tell us more details about that? Mr. Siu. First of all, as I said just now, for the RAC is the major advisory body under the government looking at rehabilitation. So there are representatives of parents, health healthcare sector and rehabilitation sector sitting on the committee. And the working group on aging of persons with intellectual disabilities was set up specifically to look at the aging problem of PIDs. Parents, healthcare sector, HA, HD, SWD, and other relevant government department officials also sitting on this working group, and they will follow up on the discussions of the working group. So we will not just be looking at short-term measures. Well, just now you gave us a lot of views, so we also hope that we can identify a long-term direction. And in the medium term, now we are facing these problems, how we can solve these problems, etc. The working group will be putting forward concrete recommendations. They already have a consensus. That is, if a consensus is formed, then the Labour and Welfare Bureau will be fighting for the relevant resources. Well, can you be more specific? You have been repeating yourself. For the terms of reference of the working group, when it comes to rehabilitation, they will be looking at home care service, days service, community support. Mr. Poon asked you about the long, medium, and short-term improvement measures. What are they, and do you have a timetable? And how about a shortage of manpower? How are you going to solve that problem? Can you be more focused, because you have told us those points many times? Well, for long term, of course, we will look at the direction and the modes of service to be provided. As for medium and short-term measures, what kind of suggestions do we have now, and how can they become more medium measures? For example, the extended care program is just a transitional measure. And in the future, what kind of mode will be used? Will it be a day care center? And also, you were very concerned just now. Now we are focusing on the aging of PIDs. So what should the manpower deployment be like? So these are the specific issues that they will be looking at. And I cited 2 examples just now. First of all, there will be a survey on service users, and this will be done in the early part of next year. And also we will be looking at service needs, and we will put together specific recommendations. Hope that we can come up with specific plans. I'm not too happy with the answer. You haven't given us a timetable. Is it 4 years, 5 years, or what? Well, can the doctor tell us more about the PID clinic? Thank you for your question. It is a psychiatric clinic for PIDs. It will be in New Territories West at Kei-chun Hospital, and there will also be at Kowloon Hospital and Queen Mary Hospitals. They already have a specific sessions for PIDs, but in other hospitals, the PIDs are treated together with other adult psychiatrics. Now, parents have told us that they wanted to have a specific session for the PID children. They think there is a problem because the PIDs now have to wait in queue together with other psychiatric patients, though, because PIDs would have some very strange behavior. For example, they would scream, so that will affect other patients. And also for the doctors, well, they originally looking at adult mental patients, but suddenly they are asked to take care of PIDs. So the parents have been asking for a specified or designated clinic for PIDs. In 2014, we think that in the first half of this year, for the remaining 4 clusters, specific clinic will be provided for PIDs. Thank you. I would like to declare my interest. I'm also a user. I think some improvement has been made, but every time when my daughter goes to the clinic, there's a new doctor. Dr. Chung, you said that there will be a specific session for PIDs, but the doctors change all the time. So there is not much continuity. I would like to thank Professor Chung for his question and the sharing of his feeling. As for PIDs and psychiatric service, we have encountered some problems. But for psychiatrists, they would have their freedom to specialize in a field. Not many psychiatrists would choose to be specialized in PIDs. I think there are only several of them in the profession. We hope that we can make an arrangement that is for a few months' time, certain psychiatrists will be focusing on PIDs. But at the moment, we do not have many psychiatrists who are specialized in PIDs, and many psychiatrists would not want to do this. So when the government officials say something, it seems that it's really great, but when you really use their services, you will find that such services are very substandard. I'm not a member of these subcommittee, but several months ago I held a press conference with you. I am particularly concerned about this issue, and I would like to thank the deputations for coming here to tell us the problem so that we have a clearer picture of the issue. Now, for the 2 government bureaus, Food and Health and Labor and Welfare, it seems that they are aware of these problems, but they are not providing appropriate services. Well, you told us that you have increased the resources, but have you made the reference calculation? How much is the shortfall? Is it 1,700 million? Well, tell us the figure, and then we will ask the governments to do something. Now, you are talking about 70 million. What does that mean? How much resources can be increased? If you just give us figures, they are meaningless. Well, if you say that you need $500 million to provide all the services, then give us the figure, and then we will talk to the government, and we may approve the funding. Just now, Mr. Poon asked you what are the long, medium, and short-term improvement measures, and you could not answer that question. Well, all these people in need have been waiting for a long time, and some of them pass away before they can get the service. So what is this long, medium-term thing? Well, tell us the year so that we will know how long we have to wait for. And you have all these working group, task force. How long will the discussions last? These are urgent needs. And this is a matter of subsidy. The government has not provided enough resources and manpower. Well, can you cooperate with NGOs? Can you provide direct subsidies or you can provide direct subsidies to the people in need so that they can go to see private doctor or go to private RCHDs. It's much faster than waiting for you to conclude your discussions. As for psychiatrists, it's not a matter of shortage of psychiatrists. It's that psychiatrists do not want to specialize in PIDs. In the past 2 weeks, the Legislative Council has been discussing the shortage of healthcare staff. Now, we should ask the Medical Council to open its doors so that overseas specialists can practice in Hong Kong. Now, you are saying that local psychiatrists do not want to focus on PIDs. So no matter how many doctors you have trained, you still cannot solve this problem. To be more practical, you should recruit psychiatrists from other countries. And these psychiatrists are interested in providing service to PIDs. Mr. Sill? Demand? Thank you, Mr. Chung. Now you have hit the nail on the head. Now the working group would not just look at medium and short-term measures. We'll also be looking at long-term planning. Now we just look where we have looked at we will be looking at the need, the demand, and then we will do data analysis. So stakeholders think that's the first thing. We have to do a survey on service users. We have to understand that how many of them are aging and what kind of service they would need. So in the upper half of next year, we'll be doing this. Well, our initial estimation is that there will be 10,000. So we need the relevant data. Well, these are actually SWD service users. We also would have to look at the community. The Census and Statistics Government is carrying out a survey on PWDs in Hong Kong, and by the end of next year, we will have a more comprehensive figure. This is about the community. As for planning, we will have to look at our CHDs and day activity centers, etc. So we need the data for long-term planning, and by having the data, we will know how much more extra resources will be needed. Ms. Cheng, I can talk about manpower. All along, the hospital authority has been trying to recruit doctors from overseas, and they can practice in Hong Kong as registered medical practitioners. Now, members have to understand this. According to the existing ordinance, the Medical Council is a statutory body, and it enjoys professional autonomy. The HA has been making a lot of effort in this area. Yes, we understand that there is a shortage in healthcare manpower. So the Food and Health Bureau has been making a lot of efforts in the past few years. There has been a review of healthcare manpower.
We've made a report to the Health Services Panel. There are 13 professional organizations, and in relation to their manpower and the way forward, we have conducted a detailed study. Hopefully, through this strategic review, we will get an idea about how much, what is the level of manpower level we need to meet demand. We realize there is an increasing demand for healthcare services, and there is also the aging population. So we hope that we will be able to complete the report to find out where we need improvement. The review will be completed at the end, in 2014, at the beginning or late 2014. We have engaged the Hong Kong U and the CUHK to conduct the thematic review for the Hong Kong U. They are looking at the 13 professionals to find out the future demand and supply for the COHK. They will look into the current regulatory regime. They will draw reference from overseas examples to see how we can improve through training and other measures. We'll wait for the consultancy's report. It's about 2014, the end of the year. We will revert to the LegCo. Mr. Poon. They know that there is shortage for specialist service. The threshold is high, and that is an obstacle. And this obstacle was put there by the Medical Council. And I'm sure that for those who are working in a psychiatric service, they meet all the qualifications. And still, they have to sit for examinations. With such high threshold, it obstructs qualified and professional people from providing the service. Perhaps in the past 5 years, what is the number of people you have engaged from overseas? And can you break it down by different disciplines, say, for example, psychiatry? Give us the information after the meeting. Deputy Chairman, I am concerned. If the doctors come from overseas, of course, some of them are Hong Kong people. But you find out about the patients through talking to them. So compared to other disciplines, you need to know about the culture. You need to be able to speak the language. If you're looking overseas to meet a demand, then you need to address these problems. I see that there is one working group after another, but what they're doing is not in the public domain. They've been doing studies. Previously, there is a working group report of aging problem for PWIDs. They've come up with a report, but what the recommendations will have to be taken up by the Rehabilitation Advisory Council. So it's a committee. So it's one working group after another. There is no timetable. So the new working group under the RAC, Rehabilitation Advisory Committee, what is their work schedule? What would they like to achieve in a year or in 2 years? Some deputations talk about definition of elderly people for PWIDs. 60, 65 for able bodies is fine, but when it comes to PWID, say for example those suffering from Down syndrome, it seems not suitable. And according to medical research, they age earlier than able-bodied counterparts. So have you considered the early aging of PWID? If not, why? And if you have, what's the way forward? I will give a short reply. The working group under the SWD targeted at the measures related to aging of PWIDs. and it studied on the directions. They have already submitted the report. On the 1st of November, some of the recommendations have been implemented. The working group under the RAC will follow this up based on that. There is consensus in the RAC. Some members belong to the working group of the SWD, and some of them are members of the network of CSS, Hong Kong CSS. So they don't just focus on coming up with recommendations. They will give proposals and specific measures. We will not remain in action in the coming 2 years waiting for the report. Where there is consensus, we will immediately implement the measures or ask for additional resources. So you say that when a measure is mature, then it will be rolled out. So which ones are going to be rolled out? We all know about the data. Users of the SWD. Well, when it comes to the physical need of PWDs, they identify the areas where they have special need, and their needs cannot be met in sheltered workshop, but they need some enhanced services. When it comes to transitions from daycare center, day activity center, or sheltered workshop to other areas, we're working on the different measures. We will roll out measures when they mature, and we also consider the way forward. Age. The first agenda item is this. In the working group, what we gather from the medical sector is that, well, there are several conclusions. Just like the general population, the life expectancy for PWIDs is longer. And when it comes to whether they age earlier, basically is for people suffering from cerebral paralysis or Down syndrome. That's more apparent. And there is no recognized age level in the international arena, but it doesn't mean that we're not doing anything. We will focus on the physical condition and the service need. That's why we conducted the survey. So, Commissioner, you will not specifically follow up on revising the definition of elderly people with PWID because there is no medical evidence showing an early aging. We will continue to look at the relevant work in overseas jurisdictions. We will focus on the physical condition and service need of PWIDs. When it comes to overseas situations, of course, we don't see a clear-cut definition of someone becoming an elderly person. When it comes to an aging definition of PWIDs, they don't look at the age, they look at the physical condition. But in Hong Kong, the situation is different. For elderly people and PWDs, the services are quite clear-cut and separated. Well, if the service is available for elderly people but not for PWDs, then there is a gap. In overseas countries, they don't set an age limit. But in Hong Kong, there is an age requirement. That's why we have a problem. When it comes to long-term care, we need to look at both PWDs and elderly people. But in Hong Kong, they are separated. Say, for example, home care service for people with a severe disability. And how is it different from the service available for elderly people? And how is it different from elderly people living at home? And what about the integrated family care service? How is it different? It's a spectrum of service. And service users should receive services based on their needs and not their age. But for us, it's segregated. For some services, they are consolidated, and for others, segregated. There needs to be a comprehensive review. So the question asked by the Deputy Chairman is important. If you use age as a criteria, then you have detached from an international trend. Well, this is Subcommittee for long-term care. And that's why we don't set an age requirement, and it's interdisciplinary and cross-sectoral with social welfare and healthcare. Do we always have to go to Mrs. Carrie Lam? Now we have both bureaus here. Do you have a view? I don't think so, but at least pass on the message. When it comes to long-term care, we do need to deal with the problem. When it comes to an aging population, it's not just about the general population, but people with disabilities as well. And they age not necessarily when they reach as late as 60s. Peter Zhang. Chairman, I think you have hit the problem right on, because we have an aging population. Without an age requirement, the services will be readily available for different groups of people. And as you said, Chairman, that some of the services are segregated. If it's not segregated, even if you have not reached 60, you will be able to receive the service. We can add new services to existing services to help them.
Well, it seems that now the dispute is over services, but I think the problem lies with the definition. If the definition is clear, then we would know how many PIDs are aging, and then we can target them and provide them with optimized services. But it seems that we still cannot come to a consensus about this definition. So I hope that in a few months' time, you need to tell us whether you would put together a definition for this. The concerned group or the working group may be looking at the life expectancy of PIDs. And then they will deduce when exactly would they start to age. You can say that you do not accept it. It's okay. However, as the government, do you have any other views? Well, how about the person's functional capacity? When his functional capacity deteriorates to a certain level, then we will regard him as an elder. You have to tell us that you'll be doing something. Well, if you are just telling us that you're going to do surveys and studies, they will last for at least 2 to 3 years. So for the PIDs that are waiting for services, they may have already passed away. So the government should tell us you are going to do it, and then you will also be doing something in the interim. I think the government's response is not comprehensive. You are just saying that for certain services you will be adding more resources to them, but you cannot solve the whole problem because you are not targeting the aging PIDs. For example, WEP, how can it be best carried forward? You don't just add money to it. You should discuss with the stakeholders. Now, what kind of services are most needed by the elderly PIDs? Now, even though the NGOs get some money, they don't know what to do. While some may use the money to employ a professional, some may use the money to hire social workers. But is that the best way forward? I think we should focus on this. We should agree on the best services to be provided, and then we will look at the resources needed for those services. In the past year, you have been collecting information. I believe that's quite comprehensive. It's about the service for PWDs, to look at the age distribution, you look at the views. And this kind of information should be disclosed to us. And then you should make use of this information and draw up plans for future measures. For the future policy address, we have also expressed our views. So in the policy address, we hope to hear more resources allocated to PWDs and PIDs. Now, you should tell us all these. You don't just beat around the bush. Well, that's what they have been doing. I think the SWD has been doing this for at least 2 years. They already have all the figures. For a PID, how many specialty clinic does he have to go to, etc. And they now have set up a new working group. They are saying that they will carry out a new survey and that will cover 10,000 PIDs. As for the definition, Mr. Siu, can you answer Mr. Chang's question? Well, that's exactly why the working group are dealing with 2 issues first. First, about the service users, and assessment will be made. We will look at their health condition and see what kind of service they need. And second, several NGOs are looking at a new cooperation, and they would come up with some new pilot schemes, and this will set a model for the future service model. So this is like what Mr. Chang said, and we can be more target-oriented, and we would know how to deploy our resources and manpower in the future. Now, because the extended care program is just a temporary measure to cope with urgent needs, we will be developing longer-term plans. The working group doesn't want to talk only, and all the NGOs are parents and taking part in this. Mr. Chang? Well, doing something is at least better than doing nothing. But a comprehensive review is also very important. The whole society is aging, and for PWDs, aging is even a more disastrous problem. If you do not do anything now, or if you do things slowly, and if you drag your feet, well, if you only hold a meeting in 1 or 2 months' time, then when can you come to a conclusion? The parents have been waiting for over 10 years. And now you have just started to have a dialogue with them. You tell them that, okay, I'll start to work now, but they have been waiting for more than 10 years. So the government should speed up. Don't do it bit by bit. For the for the task group, it has been working for 2 years. It has never been open to the public. I don't know how a dialogue can be carried out. Well, Chairman, I'm talking about today's dialogue. If we do not have the dialogue here, then there will be no communication at all. So for service users, their representatives should be sitting on certain committees to express their views. Yes, I think they have the representatives sitting on committees as well. I would like to follow up on Mr. Cheng's question. For the RAC, you have a working group now. How does it communicate with the public? Well, people are appointed to sit on it in their personal capacity. Now, for the working group, well, they have set up a task force. When they talk about directions or initial views, they will communicate with the relevant organizations. The working group may set up focus groups and invite the relevant people to come to talk to them. On the 24th of December, we will meet again. We will meet regularly to exchange views. The views of parents and concerned groups have been discussed in great details by the working group. In due course, there will be more interactions. I think the working group will face the public. We don't have to be the intermediary. And I hope there will be open forums so that the public can communicate with the working group. I agree with you. This is one of the plans of the working group. But now they are still discussing, so they have not set a timetable for that yet. Well, a new deputation has arrived. Ms. Chang Lai from St. James Settlement Family Club of Rehabilitation Services. Good morning, my name is Chang Lai. Well, PIDs are prone to a lot of diseases, and we cannot enjoy free aviation flu vaccination. I hope that the free avian flu vaccination scheme can be extended to PIDs. And for the aged PIDs, for example, Jiheng's mother is old now. He cannot take his son to the government psychiatric service. So can a psychiatrist be sent to our hostels so as to take see our inmates And for many hostels and institutions, there is a shortage of manpower. I hope that more manpower can be deployed. Thank you. Thank you, Ms. Zhang Lai. I would like to declare my interest. My daughter is also at a day activity center under the St. James settlement. Our avian flu vaccination is very important. So for day activity centers, you provide a service, but how about sheltered workshop? The members would mingle, right? Oh, the day activity centers do not have that. Only hostels have that kind of service. So for those living in hostels, they can enjoy this service. Why is it so strange? Well, sometimes these different batches of people would mingle. So some have had a jab, the others have not. Ms. Zhang, can you cover all these people? No, it's not a matter of saving money. Now, for the avian flu vaccination, we are targeting higher risk people, for example, children and elderly. We work in accordance with experts' views, and we provide avian flu vaccinations for higher risk groups. It's not about resources. That is not scientific. Well, they are all PIDs, but some of them are living in hostels, some are not. Well, we work in accordance with experts' views. The experts would designate groups which are running higher risk. So can you ask the experts to review this?
So in the center, the two groups mix. The needs and the level of disability is the same. It's just that some of them live in RCHDs and some not. Yes. For the primary care program and the influenza vaccination program, whether there will be some flexibilities, because those centers is a high-risk group. Well, for those who are living in RCHDs, and they will receive vaccinations under the program, and there are only about 30 of them. So also it's ridiculous, because at different times the government say they need or need not receive the vaccination. They sent us a letter saying that there is a resources problem, and so it's shelved. Just now they say that it's not funding problem. But we're talking about over 100 people mixing together every day. So how come they are not high risk? The age definition is rather urgent. Say for PIDs, they don't, and age doesn't count. But at the same time, age does matter. Well, about the life expectancy, if you know about statistics, you know that you need to take into account the environment, medicine, society, your age, and physical condition. It's not about juggling the figures. And you now add something. You add the functioning age. Say, for example, the age of your heart, your lungs. It doesn't matter, but you have to do something, because we're very anxious. Well, of course, you don't have to do anything if you dispense with the age requirement. We try to get the second best. You have to do something. Well, actually, our time is up. If there is no objection, I will extend it by 15 minutes to 10:45. Yes, there is additional funding from the SWD, and they listen to us. But when it comes to short-term measures, we hope that for hostels, for mildly handicapped persons, and the supported hostel, they are most hard hit because there is a serious lack of manpower. And today, autism is neglected. People with autism will have to seek psychiatric service. There is no specific centers for them. They are suffering from emotional problems on top of their psychiatric problems. So the mode of care and how the center is run will be different from other centers. About 80% of people suffering from mild to moderate mental disability are also suffering from autism. So the number is high. There are challenges faced by people suffering from autism in these hostels, supported hostels, and daycare and day activity center. In a lot of these places, there is not even healthcare workers there or nurses. Yes, you don't have to increase manpower, but you need to give them some kind of healthcare voucher so that they can seek psychiatric help, because they need a doctor, a particular doctor following them up and to give them treatment. An aging problem, this has been discussed many times. There are some international conference in Taiwan, in Japan. There is a definition, 40, 45. We have given all the literature to the SWD. In recent years, there are a lot of international conference on aging problem with of PIDs. We're talking about long-term care. And when there is a need, you need to break down the barriers to solve the problem. I see that you all have hearts to do something. Currently, there are a lot of services that are overlapping. For PIDs, when they are 40 or 45, you see that they are aging. For their parents, a lot of them are in their 70s. In 2003, we talked about this problem, and the problem is still here today. We've been asking for the same thing, making the same proposals. What I said in 2003 is the same as what I'm saying now. Time flies, as you can see, from the parents and the children here. When there is a will, there is a way. Perhaps you don't have PIDs at home, that's why you don't feel the problem. Well, I may be able to offer a good salary, but still I cannot recruit a healthcare worker. Perhaps the SWD or Mr. Siu? Well, under the work extension program, there is a half a nurse for every 10 places, for residential places, for those for hostels with moderately handicapped persons. For every 50 inmates, there is 1.5 healthcare workers. We've heard the request that there is not enough nursing manpower. We're trying to do something. We'll continue to listen to views. I'd like to clarify. There are few organizations joining the WEP and the other services. For some of our centers, there are a number of patients that are intubated. They have taken up all the medical facilities, hospitals facilities, and they are provided to us in addition. So for ECP and WEP, there are over 300 service centers. Very few of them participated. Can you give us some figures for the ECP and WEP, the Extended Care Program? There are 11 NGOs and 13 projects, 130 places. For the Work Extension Program, WEP, 9 NGOs, 13 projects, and 195 places. Well, apart from these two programs, there are some day care service and which requires more manpower. We will actively consider how to engage more people for daycare centers. But we're talking about over 300 people under the 2 programs. Yes, we'll continue to do something. Can we have some unit costs about the supported hostel, the sheltered workshop, hostel for moderately mentally handicapped persons, and the daycare center, ECP, WEP? Give me all the unit cost. Yes. I think they are just all expedient measures. For those with a deteriorating mental capacity, you just put them under the extended or extension program, but the service level is lower than what they originally received, say for example in daycare center or in sheltered workshop. You vacate the place to give to another person. Some of them have residential services, but some not. So during the day, the carers will have to find somewhere to take the PID. As Ms. Lee said, some of them need a higher level of care, but they cannot receive an appropriate service. And if that is how you deal with it, and then you only extend the service, the problem is still there. For psychiatric outreach service, I hear that there is a manpower restriction, but there is service demand. In 2003, as Mr. Yip said, perhaps because of the government's financial position or Anthony Leung, they need to cut the service, but that is no longer the case. If you can increase funding, then you can get someone, maybe someone from overseas. For dental service, you say that it's a new service. We welcome that. But can you tell us, will it be extended to those with a moderate disability? And the dental service is not an outreach service. I've recently participated in a service that reaches out to a residential service to provide the dental service to PIDs in an environment they're familiar with. I see that it is greatly beneficial because it has addressed the most serious problems. Through dental care, a lot of other problems have disappeared, say for example self-inflicting harm. So it shows that sometimes the problem lies with problems with their teeth. So can you consider it? Ms. Zhang, about the Evangel Hospital, is it extended to those with severe disability or is it limited to moderate disability? This is a pilot scheme that started in August. At first, we will only target those with moderate disability, moderate mental disability. Just like other services, we have problems with dentists. We don't have enough dentists. Some dentists may not want to spend time on children with intellectual disabilities. We've approached the Dental Association and Special Care Dentistry Association and started the pilot project on dental services. But there is a greater need for those with a severe mental disability, and you only limit the service to CSSA recipients, so the service scope is really narrow. It's a drop in the ocean. You need manpower, but there is none. You need premises, and there is none. For those waiting for a place in severe mental disability hostels, they have to wait for easily over 10 years. For daycare center, there is not enough services, and there is an aging problem, and you say that there is not enough manpower for healthcare, for outreach service, for dental service. So what actually is the government doing? We're talking about a group of people who have the greatest need and who cannot take care of themselves. And this is what you come up with. There's nothing else I can say. As Ms. Lee said, that we have been talking about this for over 10 years. Mr. Yip, I remember that you have started your work many years ago, but that our time is up. Thank you, Deputations, for joining us. The next meeting will be on the 14th of January, 10:45, on integrated home care service. Thank you.